And welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Jeffrey Glad. He's a family physician. Today's KevinMD article is From Burnout to Breakthrough, Why Treating Yourself Like a Patient Could Save Your Medical Career. Jeffrey, welcome to the show.
Thanks, Kevin. It's great to be here.
All right. So your article talks a little bit about your story. So maybe we could start there. Tell us what this article is about, a little bit about your story and journey for those that didn't get a chance to read your KevinMD piece.
Yeah, sure. So this spans 18 years. I mean, came out solo family practice doc, doing full spectrum care, obstetrics, GI procedures, inpatient medicine, 40 patients a day. And I didn't even realize the level of burnout and unhealth that I was living, and sort of had an aha to take care of myself, focus on nutrition first. And within 6 months, lost 50 pounds,
Oh, wow.
got off of the SSRIs I was self-medicating myself with for panic attacks since medical school. And I really had, this personal transformation that led me to then study what happened to me, deep dive into nutrition, understand then, the other aspects of lifestyle that I didn't get educated on. So I didn't have as part of my own personal journey, mindfulness, nutrition, and then went into integrative medicine and studied at the University of Arizona and sort of understood like there's an entire discipline of care delivery based on these principles that I didn't learn, most of us didn't learn. And so then that transformed my career. And I really started talking to patients about some of these topics. And, their interest and intrigue and desire to learn more really drove me to then change my practice toward more of this lifestyle first focus and really digging in deeper. And now, I've been doing this now for, 15 years in practice. And, I just keep seeing, we need really to drive practitioners to understanding these pieces. I still don't see that we're getting that in medical education,
Mm-hmm.
but the patient demand is growing, and how can practitioners, address that demand, but also seeing all of the stats on burnout and knowing my colleagues who are burning out, really took the chance to kind of put this article out there to try to inspire, like, let's think physician, heal thyself first. And can we use some of these core principles to kind of build on?
So you said that you were practicing for 16 years as a family physician, doing it all. And tell me what you were feeling, the symptoms that you were experiencing that led you to this more lifestyle approach. What made you feel like you were burning out after those 16 years of practice?
Yeah, I mean, it was sort of a compounding effect. My panic attack started, in a surgery room in third year of medical school, and I didn't know what was going on. What was sort of bordering on leaving medical school, and understood, okay, let me see if I can medicate this, and started there. And then the burnout side was just the mental and emotional overwhelm of first starting with a solo practice and
Hmm.
sort of just being burdened by the financial aspects of running a practice and trying to see all of these patients and do all my clinical duties. And so sleep then became a really big problem, trouble falling asleep, trouble staying asleep. My lack of energy was catching up with me. And I just kept seeing all these things adding up. And I couldn't function, and actually took a path of like, well, maybe if I lose weight, that's the way to go. And so that's where nutrition kind of started for me, was more with a weight loss focus. But what I learned on the back end was it was way more important than weight loss for me. It was energy, it was getting good sleep, it was being able to get off of medication because now mentally and emotionally I was significantly improved. So for me, that was the big aha.
So I just want to dig down deep in terms of what are some of the exact changes that you made in your own lifestyle, not only to, of course, lose the weight, but all these other beneficial effects as well. So what specific changes did you make?
Yeah, so specifically, I, really sort of understood the value of whole foods, and, kind of worked in partnership with my wife on, okay, let's clean up the pantry and really kind of, start shopping at the farmer's market and really finding quick and convenient meals that were based on whole foods, right? Meats, eggs, nuts, fruits and vegetables. And even that like seems obvious and elementary, but it wasn't for a busy lifestyle and just running and going. Stay away from the rep dinners and rep lunches, and really just kind of focus on homemade food. So that was the nutrition side of it. From a sleep perspective, just kind of taking some of those basic principles of, let's make sure the room's dark, let's make sure there's a consistent routine, let's try to stay off of screens, and again, really leading up, kind of building up to a good night's sleep. Exercise became really, really important. I started out as a runner, and that was sort of my exercise of choice, and then really sort of understood the importance of strength training and shifted. And that's really when I had another big unlock, is
Mhm.
shifted into bringing more strength training into my routine. But again, fitting that into a schedule becomes really hard. So, I started with the basic 7-minute workout, right? I send patients to the New York Times article on this. Johnson
Yeah.
and Johnson has an app for this. Like 7 minutes a day of movement is significant when you're not moving at all and you're sitting at a desk, you're just moving from office to office. So those would be the pieces. And then later on brought in sort of the mindfulness component by finding one of the apps and really dedicating and scheduling in my calendar 15 minutes a day of just sort of pressing pause. Sometimes that meant just stepping out, turning my car on and sitting in the parking lot for that 15 minutes. But really pressing pause in the middle of the day was also a big piece of just kind of getting through a day and really feeling sharp and connected with patients.
So, specific to your burnout that you were having mid-career, tell us about this 180 in your lifestyle. How did that address your burnout and improve it?
Yeah, I actually think that it really by, my mental sharpness improved, my mental energy improved. And then, but I think really the big piece for me was as I started to share this with patients, not necessarily diving into my personal story, but really asking them, hey, what have you been eating? How are you sleeping? How are you managing stress, and where does your stress come from? What I found was those interactions with patients were so much more enjoyable
Yeah.
than, let's jack up your insulin dose, let's add
Hmm.
2 more blood pressure medicines. And again, that may have been part of the treatment plan, but the discussion of some of those core principles, I just found my patients' eyes lighting up. And so my day and my relationship with patients improved. And I think that's really what pulled me out of the whole burnout side.
So, what's your practice like now? Is it a full integrative practice where you specifically exclusively focus on lifestyle and wellness? Is it a little bit of blend about what you traditionally did? So, what's your practice like now?
Yeah, I would say it's more of a soft primary care practice.
Hmm.
So we have patients that we maintain long-term relationships with, but it really starts out with a deep dive on what are the core foundational aspects that you're doing as a patient, thinking about this whole person care view. So we have a long intake form that walks them through, what's their diet look like, what's their sleep look like, where does their stress come from, but then I also pair that with a health coach who's managing a lot of the consultation around movement, mindfulness, nutrition, so that I can focus more on the deeper aspects of health, whether it's again medication or diagnostics. But that's what the practice looks like today, is more of that integrative, full spectrum, but also collaborative with a health coach on the team.
So, as you know, I'm an internal medicine primary care doctor, still a relatively traditional model. Every 15 minutes, I'm seeing patients for follow ups, 20 minutes sometimes for a physical. Now, what are some easy wins that I can implement from a lifestyle wellness standpoint? Obviously, I don't have a dedicated practice like yourself, but for other doctors like myself with such limited time, what are some easy wins that we could implement in the exam room in a typical 15 to 20-minute visit that you used to have?
Yeah, no, it's a great question, and it's a big problem, right? I think it starts by just simply asking some questions around that patient's lifestyle and understanding the connections between the chronic condition they're dealing with or what they're trying to prevent, and you sort of just again highlighting the potential connection. That's about all you've got in that 15 minutes. Other things I've seen work and I've done in my practice is again, having a collaborative team of whether that's a health coach or a dietitian, or being able to refer out to somebody locally on the fitness side of things. Because again, we don't necessarily have that training or education, and we don't necessarily have the time, but highlighting it. I find the patients that come to me are still telling me their primary care doctors or their specialists are saying, not asking about these pieces, or they're actually saying they don't matter. And I think that's just wrong. So I think highlighting and connecting for that patient that lifestyle plays a role. I'm not going to solve that for you in 15 minutes. Let me set you up with, a collaborative team that I'm working with and can send you off to. I think the other thing that I think really drives a lot of energy for practitioners moving into this whole person care world is group appointments,
Mhm.
right? Bringing 8 to 12 patients in together, based on maybe a specific theme, type 2 diabetes, pre-diabetes, inflammation type conditions, and really having a 60 to 90-minute presentation and discussion around the aspects of lifestyle, which can fit into that reimbursement model and also, kind of create community within the practice.
So you mentioned this a couple times in terms of the lack of lifestyle training that most physicians have. And of course, you've had the conventional training, and then you went to Arizona, and then you had a lifestyle training. What would you implement in our traditional medical curriculum that they're not getting, having been in both sides?
Yeah, I mean, I think we really need to do a better job of just teaching whole foods nutrition, its importance, how to guide a patient in understanding this piece, and it actually may just end up being a self-care education path that happens for all medical students, and just help them take care of themselves, right? Because I think that's one of the things I would have really loved is understanding the role of lifestyle, nutrition, mindfulness, sleep, fitness, and how it applies to me in my busy medical school, education and all-nighters, but making sure to find that time and carve that time out. And then as you get into training, how can you maintain some semblance of that foundation? I think again, the whole message of that article was physician heal thyself. If we can
Hmm.
teach the practitioners these tools early, I think that really sets us up to kind of be able to provide some of this connection to patients we see.
I talked to a lot of physicians who were where you were after 16 years of your practice. They're burnt out, and they always say they sometimes want a way out of medicine. What are some solutions that you could give to them? What are some tips that you could share with these burnt out physicians who perhaps are so burnt out they're looking for a way outside of medicine? Is there a way for them to turn around just like you did?
Gosh, I certainly hope so, Kevin. We really need something to happen to be able to drive that change. Again, I think it has to start with really looking in the mirror and evaluating that practitioner's lifestyle and making one small change. Now, that may be a personal journey of personal learning and application. I would encourage you to find somebody locally who sort of specializes in this, whether that's a dietitian or a health coach or someone who is an expert in fitness, and really carve out some time. Does that mean one, two, or three less patient visits a day? Again, based on the employment situation, that may be hard to do, but can you carve out some time for yourself, which becomes critical to maintain longevity in your practice and find a way to enjoy it. So I really think finding a guide to help you understand this and apply it to yourself, which may end up becoming that referral team, or that collaborative teammate that you can then send patients to over time.
You mentioned coaching a few times, and there was an article in the New York Times I read recently about how coaching still is a relatively foreign concept in medicine, right? You have coaching, of course, in high performance athletes, but physicians, we do high performance things all the time, and sometimes we do so without a coach. So tell us about the role of coaching as you evolve through your practice.
Yeah, so I've found having a health coach in our practice has been huge for patients to just have that resource for the lifestyle side of their guidance and their care. There's a number of great health coaching education centers, that go through a couple years of training. Certainly, finding a coach who sort of understands their level and where they fit and doesn't sort of overstep the expertise, it is really key, which is why, seeing one, maybe if you're the physician as a patient and
Mhm.
understanding, okay, they can be really good at diving into someone's nutrition and helping them clean up the pantry. I've had our health coach take patients to the grocery store and walk them through what to look for, how to read a food label, to understand some of the supplementation that, can be also helpful for patients, and educating them on the right forms and the right doses under my oversight and guidance. And then just talking about some of those basic aspects of sleep, mindfulness, those really are the key pieces where a health coach can be sort of that connector to the patient, and the physician can stay, in the high level, taking care of the things that they really trained and are experts in.
We're talking to Jeffrey Glad. He's a family physician. Today's Kevin MD article is From Burnout to Breakthrough: Why Treating Yourself Like a Patient Could Save Your Medical Career. Jeffrey, let's end with some take-home messages that you want to leave with the Kevin MD audience.
Yeah, again, I think the take-home message is it's clear that lifestyle and us helping our patients connect lifestyle to their health concerns is critical. I mean, patients are getting this information from everywhere, and I think one of the big opportunities we have as physicians, patients still want practitioner guidance.
Mm-hmm.
They're all getting lost in all of this messaging, the podcasts, the books, the celebrities, but they don't want to do this themselves. And so, as a physician, taking a personal journey yourself and improving your health will help alleviate the burnout side, but it will also allow you to be that guide that patients really desire. And again, if you can't handle that yourself in terms of just the 15-minute office visit or the busy practice, finding a team of health coaches, dietitians can really unlock that piece, and really increase the relationship with your patients, and really grow your practice in a positive, enjoyable way.
Jeffrey, thank you so much for sharing your story, time, and insight. And thanks again for coming on the show.
Thanks, Kevin. Great to see you.